Aging can be defined as the time-related deterioration of the physiological functions necessary for survival and fertility. The characteristics of aging, as distinguished from diseases of aging, such as cancer and heart disease, affect all the individuals of a species. Sexuality can be defined as the capacity for sexual feelings, a person's sexual orientation or preference, and/or sexual activity. Aging and sexuality is a topic that is misunderstood by many due to lack of public knowledge, along with assumptions made about the elderly population. Misunderstandings of aging may perpetuate older adult sexual stigma in clinical research and general public domains. Stigma is a contributing factor as to how older adults and even the general population act towards older adults and sex. According to an article by Tupi and authors, men seem to have higher stigmatic beliefs than women. Also, stereotyping and the stigma with older adults and sexuality is what leads to exclusion from sexual health. Research has shown that 72.6% of men and 70.8% of women believe sexual dysfunction is part of aging, and many believe it is not treatable. This is a myth because the genitalia still functions, but physiological changes may occur, such as decreased erection, vaginal dryness, and although function may be decreased as an individual ages, there are ways to decrease all of these issues. Many changes occur in the body as one ages. The reproductive organs go through changes that involve decreased hormone production, along with specific changes in women and men. Some of the changes that women go through include menopause, which usually occurs between the ages of 45 and 65 and involves the menstrual cycle to stop and the ovaries stop producing estrogen. There is also a thinning of the vaginal wall, which allows for easier tearing. Thinning can cause chronic irritation, dryness, and a discharge from the vagina and infection. Due to decreased estrogen levels, which stimulate milk ducts in breasts, they decrease in size. The connective tissue also decreases, which may cause sagging and changes in shape and firmness. Also, after menopause, the uterus, fallopian tubes, and ovaries become smaller. For men, there is decreased testosterone levels produced, and the reproductive changes occur over a longer period of time and they are more gradual. Aging changes in the male reproductive system occur primarily in the testes. Testicular tissue mass decreases. The level of male sex hormone, testosterone, will decrease slowly, if it does at all, and there may be problems getting an erection, which is also a general slowing. This is known as erectile dysfunction. The tubes that carry sperm may become less elastic, a process called sclerosis, and the testes continue to produce sperm, but the rate of sperm cell production slows. The epididymis, seminal vesicles, and prostate gland lose some of their surface cells, but they continue to produce the fluid that helps carry sperm. This is true. A study conducted by the Indian Journal of Psychiatry on sexuality, desire, activity, and intimacy in the elderly showed a general decrease in sexual desire as one ages, if they are suffering from a chronic illness. But a desire still exists, and many individuals still maintain the same desire they've always had.
This table shows gender and factors affecting sexual desire, with the number one factor affecting sexual desire in men as deteriorating health, and the number one factor affecting sexual desire in women to be age.
This is a myth because although older adults' bones and muscles may be more fragile than a younger adult, it does not mean that they will get injured from having sex. This is true. Sex can be just as good and pleasurable when you grow older. A study suggested that it can even be more pleasurable when you grow older. This is definitely a myth. There is actually an increasing percentage of older people who contract STIs because they do not use protection during intercourse. Many older adults believe that since women are postmenopausal and cannot get pregnant, that there is no need for condoms. But without condoms, anyone has a risk of contracting a sexually transmitted infections. There is, in fact, a rise in STI transmission among the older populations.
According to the Center for Disease Control, close to 2,550 cases of syphilis were reported among adults between the ages of 45 and 65 in 2010, up from around 900 cases in 2000. The reported number of chlamydia cases in the age group almost tripled, from around 6,700 in 2000 to 19,600 a decade later. Just 12% of single men who were dating and 32% of women who were dating reported always using condoms during sex. Older adults are at heightened risk for STIs due to decreased immune functioning, thinning of the vaginal wall tissue, and an increase in vaginal tears due to decreased lubrication. Healthcare providers should discuss safe sex practices with their elderly patients, as many older adults frequently forego the use of contraceptives for various reasons. The two most common reasons are that females are postmenopausal, which means they have a lack of pregnancy risk, and may not have obtained safer sex education. This increase in sexually transmitted diseases among the older population emphasizes the fact that acknowledgement of sex among this age group needs to take place, and safe sex campaigns need to focus on the elderly just as much, if not more, as they do on the younger population. Our example article is called Sexual Function and Aging, and it's retrieved from the South African Medical Journal. It focuses on erectile dysfunction in men, conversing about sex with physicians, and also menopause in women. A total of 3,005 people aged between 57 and 85 years were surveyed in the National Social Life, Health, and Aging Project. Sexual activity was defined as any mutually voluntary activity with another person that involves sexual contact, whether or not intercourse or orgasm occurs. The participants were questioned on multiple factors related to sexuality, such as relationship status and its impact on sexual behavior, the individual's doctor-patient relationship, medical risk factors associated with erectile dysfunction, and also problems that were specific to women, for example, menopause. The National Social Life, Health, and Aging Project Prevalence of Sexual Activity shows the percentages of individuals who reported being sexually active and the percentage of people who rated sex as not important. It is estimated that only 38% of men and 22% of women discuss sex with a doctor after the age of 50. It is possible that poor communication between doctors and their patients is due to the unwillingness of both parties to initiate the discussion, confounded by age and sex differences. Attitudes about sexuality, especially as people grow older, may also inhibit discussions. It has been reported that 70 to 90% of women are willing to discuss sexual behavior with their healthcare provider and require information about sexual well-being. However, most of them hope that the healthcare professional will raise the issue. In a study of sexual healthcare needs of women greater than or equal to 65 years, 68% of women reported that the topic of sexuality had never arisen in a consultation, while 79% would have discussed the topic had it been initiated by a doctor. 97% believed that it was important for a doctor to know about their sexuality. While multiple medical risk factors are associated with erectile dysfunction, age is the greatest risk factor. Erectile dysfunction is found in 20 to 40% of men aged 60 to 69 years and increases to 50 to 100% in men over 70. Sildenafil, vardenafil, and tadalafil are all phosphodiesterase type 5 inhibitors, registered for the treatment of erectile dysfunction. They are effective in reducing erectile dysfunction by up to 65% and associated with no increase in myocardial infarction or death, cardiac ischemia, or cardiac hemodynamics on exercise testing. Surveys have found that 19 to 27% of women report dryness, irritation, or itching. Up to 80% of women have found it to affect their quality of life, while 7% reported that their healthcare practitioner raised the problem. Older persons engaging in regular consensual sex have shown improved well-being in both physical and psychological health associated with fewer health problems as they age. Engaging in intercourse has been correlated with improved intimate relationships, improved cardiovascular health, and even lower rates of depression. Sexual activity and problems associated with sex are common among older persons. It is important that healthcare professionals become knowledgeable about the sexual practices of their older patients. Improved knowledge may translate into improved information for patients and the ability to identify treatable problems, enhancing the quality of life and well-being of older persons. Limitation to the study. The only method of collecting data was through a survey, which carries multiple issues. These issues include individuals may respond in ways to impress the researcher. Individuals may not understand the questions, which means their responses may be inaccurate. Individuals may be embarrassed by this topic and may not respond truthfully, and these factors may skew the data. Ways to improve the stigma and negative attitudes towards aging and sexuality include decreasing the stereotyping, as many individuals think that older adults do not have sex and that they shouldn't be thinking about it or doing it. Also, if there was more advertising and awareness of older adults and sexuality, the negative outlook may be decreased. If it seems to be acceptable in society, the stereotyping and negative outlooks will be decreased. A study by 2BAL in 2015 suggested that older adults might internalize stereotypes and conform in a self-fulfilling prophecy. Thus, if they are expected not to talk about it, they won't. Of the adults aged 75 to 85 years old surveyed, 54% were sexually active, often engaging in some form of sexual activity 2 to 3 times a month. Surprising to many, of those older adults, 23% were sexually active once a week or more. Older adults reported sexual activity similar to ages 18 to 59, contradicting the long-standing stereotype that older adults have less sex. Older adults may avoid sexual activity due to a variety of reasons. Diabetes, heart conditions, and cancer are all common conditions associated with sexual activity, as well as inaccurate fears of injury, heart attack, or lacking desire associated with medication use. Inquiring about sexual activity provides insight into a variety of different physiological, psychological, and social concerns of the patient, including how the patient perceives their body, social expectations regarding sexual activity, health, and knowledge regarding aging. It is often the case that sexual activity and health are linked. By acknowledging this link, stigma regarding sexual activity can be reduced.